This video is going to cover psychological and neuropsychological assessments. These assessments are great for diagnosing a number of disorders, ADD and ADHD, OCD, depression, autism, learning disabilities, anxieties, and all kinds of other developmental, emotional, intellectual, and academic disorders. So it can be used to assess and diagnose a wide variety of disorders. And from this assessment, it's going to help point out the strengths and weaknesses of that person so that a plan can be put into place. So as a parent or as a student, if you're not sure if your child needs a psychological or neuropsychological assessment, you can ask yourself these questions. Does life feel harder for your child than you think it should? Does your child struggle and get frustrated at school? Does your child have difficulty getting along with friends and family? Do you find yourself making too many excuses for your child's behavior? Is your child as happy as you think he or she should be? So those are the key questions as a parent that you could ask yourself. And then if those questions are true, or you're worried because of those questions, you can have that assessment done. So let's go into what does assessment involve. So a psychological evaluation, it's a process so gathering information using specific tests, interviews, review of records, consultation with other professionals, so psychologists, psychiatrists, teachers, etc., and direct observations, so somebody observing a student in the classroom setting. Then all this information is going to be integrated in order to answer questions about the individual's skills, functioning, emotions, and behavior. So we have a school psychologist at our school, and that's essentially what the process involves. So all those different things. So somebody has to observe the student in the classroom setting, and there's a checklist there rating the student 1 to 4 on a number of different things. Then a checklist and a questionnaire gets sent to all the teachers that has that student, and the school psychologist will meet with that student one-on-one to do a number of specific tests on that student, and all of that comprehensive data will be used. So this assessment can be used to clarify treatment strategies and interventions. Let's see. Also, using these testings, it provides better understanding of that person's behavior and learning in school, at home, and in the community. So something that we also do is a questionnaire sent home to the parent, so that gives us kind of an idea of what's going on at home. How does that student act at home? Are we seeing something different at home than we are at school, which is very common. I've had students that are absolutely amazing at school, but their parents give us tell us differently. They say that they misbehave at home, they're doing this at home, so that's common. And a lot of students, they're going to act differently at home than they do at school. So that is common. So this assessment should be conducted by a clinical psychologist or neuropsychologist. They've been specifically trained to administer and interpret this testing data, and to use this data and the developmental history to arrive at a diagnostic conclusion. So they're going to take all of the data that's been collected and come up with the report. So let's go through some questions that a psychological evaluation will answer. Does this individual have a learning disability? Does this person have attention deficit hyperactivity disorder, ADHD? Is the person gifted? Is this person experiencing a psychological disorder such as depression or anxiety? What are this person's cognitive and academic strengths and weaknesses? What are this person's interpersonal strengths and weaknesses? How does this person process information and learn information best? What are the specific characteristics of this person's strengths and weaknesses? And what individualized treatment will be most effective? How can a complex set of difficulties that may include cognitive concerns, academic problems, emotional symptoms, and/or medical issues be clarified such that appropriate recommendations can be made and then prioritized? So I know that there's a lot of questions there. You can even play back the video if you want me to go through them again. But uh, in my own experience, this is something that happens during the triennials every 3 years for students that have an IEP, or at before that original IEP meeting, to get the student needs to be tested to go through this evaluation to get an IEP, to get that help. So it'll identify, does this person have a disorder? What are their strengths? What are their weaknesses? How are their academics? Are they gifted? This and that. So all those questions are going to be answered through these psychological and neuropsychological assessments.